The challenges. Every day it's a challenge. I think all of my colleagues would agree that these roles that we're in as facilitators are the hardest jobs we've had. We have people at the end of their career, we've got mid-career people, we've got millennials. These are really hard jobs. And we're trying to work with leaders, work with doctors, work with frontline staff, and they're really busy. They've got a lot of things on their mind, and trying to work with them and trying to find the time to work with them and coach them has been a challenge. I'm very much relationship based, so you got to build those relationships with people, and that takes time. If you rush in to try to solve somebody's problem for them or show them a nice shiny tool that you just learned, they may not necessarily agree with that or go along with that. But if you can build the relationship, that's it. So I think the biggest challenge for us has been how to get away from a tool-based approach to relationships and being flexible to use different tools. People are very focused on the tools, and I think early in your journey you are. It's all tools, but as I've gone deeper, it's the tools are a thing. The organization's been in a lean journey for over 6 years now, and I personally have been in my personal lean journey for a little over 3 years. We've used a variety. Some of it's been value stream based, so we've had some big value streams. We've attempted to do model sites. We've done a lot of managing for daily improvement, so daily processes, small improvement. We've done host and strategy deployment. You'll see that as well. The biggest shining example is we built a new building using Lean 2P, design, process, production, and the building is amazing. It's incredibly efficient. There's very little waiting rooms. There's all the flow components you would want to have in a new building. That's the biggest example. And then the smaller examples on a daily basis, meeting the needs of our patients. If we improved a process so an RN has capacity to take a phone call live from a patient, can talk to the patient using standard work and using a triage protocol, can determine whether or not that patient should come in. And if she decides the patient should come in, bringing the patient in and avoiding potentially an ER admission or any of those types of things. Those are things that are on a daily basis that are happening, which are really exciting. Every day makes a case to lean to me. There's so much waste in the process. There's so much errors that happen. I personally had to call my doctor recently, and we're up to 5 interactions, and we still haven't spoken. It's so hard to get in touch with to reach the healthcare system. Um, we have to improve it. It's my wife's. We've had some medical challenges in our family, and where we have trouble navigating the system. I can't imagine what a elderly family or a low income or challenged families how they access the system. It's so complicated. It's so complex, and we've only just started. I think the what we'll see Lean doing 10, 15 years from now will be amazing. Um, but very few people will be able to do it well, I think, because it's so hard. It's so challenging. It's the hardest thing that you'll do. And I think the biggest challenge I see for Lean right now is that leaders don't really get it. They're delegating Lean to a department, to people. They don't feel they need to learn it. And I've worked with leaders who have done that, and I've worked with leaders who get it. The progress you make when somebody gets it is just phenomenal, because once they get it, the people under them start to get it, and the people under them start to get it, and then now you've got something. Leadership readiness is definitely a key failure mode. I think folks who've been very successful in a traditional leadership style can sometimes be identified as good potential lean leaders, and they're different skills, and some folks really aren't. Some folks learn it and they're great at it, and some folks really struggle with it. So I've seen leadership readiness be a major failure point. We've certainly made that some of those challenges over our years. And I think the approach of the care improvement or your lean department, we're all so passionate about this work, we all love it. And sometimes we can't line up when other people don't want to do this. We don't understand why. How could you not want to do this? And it's not that they don't want to do this. It's just that they have a way of doing it, that they've been doing it for years. They don't even know their system doesn't work. And you go in and tell them their system doesn't work, and now they're defensive. Now you've hurt that relationship. I've done it many times. And you catch yourself and you got to reflect on it, but you've got to keep coming back. You got to keep coming back, I think, is eventually people see that. They say, oh, wait a second, you're still here? Like, yeah, we're still here. We're still here.